Hello, my name is Danielle Campbell, and I'm an ASHA certified speech and language pathologist. Today, I would like to talk with you about chronic cough and offer you a few strategies for how you can manage your cough. Before we begin, this video is meant to provide a starting point while you are awaiting a formal evaluation by a licensed speech and language pathologist. It is not a substitute for direct patient care. Additionally, please make sure to reach out to your healthcare provider if you are experiencing a chronic cough. A chronic cough is defined as a cough that is lasting longer in duration than 4 weeks for children and more than 8 weeks in adults. Two strategies that you can use to suppress your cough is an effortful swallow and the sniff and swallow. You will want to use these strategies instead of constantly coughing, as this will help to reduce any further irritation at the level of the vocal folds. The first way to use the effortful swallow is to swallow hard, using your own saliva or a sip of liquid. You could also suck on ice chips or a hard candy. To use the sniff and swallow technique, you will quickly sniff and then swallow. Either of these strategies can help you to use a replacement instead of continuing to cough. In addition to using replacement strategies, you can also use some breathing techniques. The first breathing exercise is the pursed lip breathing exercise. You will keep your lips slightly open and pursed, and on the inhale, you will inhale as if you are breathing air in through a straw, and on the exhale as if you are blowing out birthday candles. It will look something like this. The second breathing exercise is to exhale using the S sound. You will want to have a relaxed tongue posture. Place your tongue on the floor of the mouth. Inhale through your nose, and on the exhale, use the S sound. It would look something like this. When you are breathing, make sure to engage your abdominal region. To do this, you will fill up air in your abdomen instead of in your clavicle region. When you breathe in through your clavicle region, it is very shallow. It is better to breathe in through your abdominal region. It would look something like this. You should practice these breathing techniques and cough suppression strategies throughout the day, not only when you feel the urge to cough. In addition to using these cough suppression techniques and breathing strategies, please be mindful of good vocal hygiene. This would include avoiding any irritants that increase your cough, such as smoking, as well as staying hydrated. Liquids such as water, milk, and orange juice will help to keep you hydrated and thin your mucus. Make sure to avoid any drying medications and alcohol. As you are awaiting care by a licensed SLP, you can feel free to use these strategies to help manage your chronic cough. To locate a provider within your area, please go to the American Speech, Language, and Hearing Association's website at www.asha.org. Thank you.